Hey, all, Dr. Wells here from St. Augustine. We're here for our fourth and final portion of our four-part series on the supplement that every PT and a rehab professional needs to know more about, and that's collagen. So today we're going to talk specifically about collagen and osteoarthritis. In our first part, we talked about exercise recovery. Second part, we talked about body composition and does collagen change it or not. The third part, we focused on tendon healing, right? Particularly middle-aged adults and patellar tendinopathy. Today, we're going to focus on osteoarthritis. I have a lot of experience in this area. I have a lot of patients that have osteoarthritis. Being in Florida, we have a typically skewed middle to older population. A lot of them were very physically active when they're younger. Some of them were college-age athletes, and a lot of them took some beatings, some wear and tear, and had some surgery. So collagen has been a tool that I've been using in my practice for a couple of years, and I've seen very good results for patients with osteoarthritis, particularly of the knee. So today, the study I'm focusing on is Park et al. This is published in 2025, and it looks at the efficacy and safety of low molecular weight collagen, peptides, in knee osteoarthritis. It's a double-blinded randomized control trial. So this is kind of like the peak of all studies, right? So what do they find? Well, basically, with individuals that have OA or acute tendon issues, they found undenatured type 2 collagen helps reduce inflammation, typically dosed at around 40 milligrams per day. Now, the overall collagen peptide loading that they recommend is anywhere from 10 to 15 grams per day. What did they see? Well, here's the cool thing is they use actual like physical therapy and rehab outcomes. They use something called the WOMAC, right? That's something that we used. It's the Western Ontario McMaster Arthritis Index. I believe that's the best I can do with that acronym. But basically, it's a knee index that looks at osteoarthritis measures like bending, straightening, stiffness. They saw significant improvements in the WOMAC. They also saw significant improvements in VAS. That's the reported pain for these particular athletes. And what they used as a comparator was glucosamine. And that's something I know that we talked about in my three-part course series about how the evidence for glucosamine is just kind of getting weaker and weaker, right? So maybe collagen needs to be the one that steps up. And I really encourage you, if you're a PT or an OT or strength coach, start looking more at the data on collagen, and not just the collagen peptides, but also some of those undenatured collagen type 2 fiber or type 2 collagen, because it has an actual inflammatory effect. So it actually helps to suppress some of the interleukins, some of the cytokines that promote inflammation. So you kind of get a double-edged response. So if a patient's not in an acute flare, they do get by on just collagen peptides at anywhere from 10 to 15 grams per day. However, if someone's in an acute flare, they may need that extra type 2 undenatured collagen to help really suppress the inflammation. So if you like this, check out our three-part course series. It's a certificate program for physical therapists, but also for any rehab professionals. It's approved for PTs for continuing ed. We also have a bonus course that's focused on supplements, evidence-based supplements, and it has handouts for you so you can take it into the clinic the next day. It talks about some of these collagen protocols and more. So like, subscribe, check it out, and stay tuned for our next series.